Hi, it's Missy. This is the remake of the video about protecting your medications. I didn't like the way the original came out because I did it while I'd been awake for over 2 days, and it wasn't as clear as I wanted it to be, and some points I wanted to make, I didn't because I was just too tired. I'm going to separate it into two in order to keep the time limit down. So what I'm going to cover in this video would be general discussion of the meds and why it would be a good idea for you to follow the steps to protect your medications, as well as what I do to protect mine. I do all of the steps that I'm about to tell you. The second video will give the steps itself for at the doctor's office, at the pharmacy, and within your own house. And just like the judging video, I got notes. This way I won't forget what I wanted to say. So here we go. People who are chronically ill and or in chronic pain often take many prescription medications. Depending on your illness or your condition that's causing chronic pain, you can be on a wide variety of drugs, such as chemotherapy meds like methotrexate for immune system suppression, or corticosteroids like prednisone or methylprednisolone for inflammation, anti-seizure meds, anticonvulsants like Lyrica and Neurontin. They also work for nerve pain. Opiates, of course, Percocet, morphine, oxycodone for pain. Benzodiazepine like Xanax and Valium, those are for anxiety. They can also be used as muscle relaxers. Then of course there's muscle relaxers themselves like Flexeril, which is cyclobenzaprine, or Xanaflex, which is tizanidine, and others. Of course those are for muscle spasms. Then you also have the antidepressants, the SSRIs, which are selective serotonin reuptake inhibitors, and the SNRIs, which are serotonin and norepinephrine reuptake inhibitors. These are drugs such as Pristiq, Zoloft, Cymbalta, Effexor, and more. And then the other class of antidepressants called tricyclic antidepressants, amitriptyline, which is Elavil. These are used for depression. The tricyclics can be used to prevent migraines, for sleeping, as well as anxiety, and in the case of Cymbalta and Effexor, etc., for some patients, it helps with their pain level, like the Cymbalta's been doing for me. Many of these meds do have the ability to make the patient physically dependent. This means that their bodies are used to having the presence of the drug in them, and when the drug is stopped, they'll go through withdrawal. This is not the same as addiction. You can have withdrawal symptoms if, say, you're someone that drinks a lot of Coca-Cola, Pepsi, or coffee. They all have caffeine in them, and caffeine is addictive. If you stop taking or drinking any of those products that contain caffeine, you will have withdrawal. You may have headaches, a little bit of sweating, some queasiness, maybe some trembling. That's because your body was used to having the caffeine, and without it, it withdraws. Some of the classes of drugs that will make your body dependent and thus give you withdrawals are the corticosteroids, such as prednisone, the benzodiazepines, Valium, Xanax, the opiates, the painkillers, and antidepressants, both the SSRIs, the SNRIs, and then also tricyclic antidepressants. There are probably other drug classes that cause some dependency, but I'm not going to name them all. Just know that, yes, you can become physically dependent without being addicted, and if you wish to stop your medication, to do it safely, because withdrawal can be dangerous. To do it, to taper off, don't just stop taking them. Some of these meds also have abuse potential, because when they're taken by people who are not in pain or who are not sick, with the symptoms that that drug is used to treat, such as anxiety. They get high off of them instead. The drug doesn't have what it needs to work on. If you're not feeling pain, then the drug has no pain to take care of, so you get high. The opiates, the benzodiazepines, and some sleep meds all have abuse potential. Addicts will take these medications to get that high feeling, but many chronic pain patients and the chronically ill take these medications to control their symptoms of their illnesses as well as the pain overall. They are not taking the meds to get high. They're taking the meds in order to, feel better. One of the main reasons to actively protect your meds is to protect them from theft. If your meds get stolen, they're going to end up right out on the street with somebody trying to sell them. And you can get in a lot of trouble for that. Another good reason for all of this is the current political climate and the DEA, which is currently going after the chronically ill and chronic pain patients and the doctors that treat them. Excuse me. They're doing this to try to cut down on the availability of prescription medications out on the street. That's going to be an entire another topic, because a lot of the things they're doing and the information they're using to gain approval and support from the public for their actions is not accurate. As a result, addicts are having a much harder time getting a hold of their drug of choice. Some of them have switched to heroin instead, but others will turn to robbery, as will the dealers that are trying to get these drugs to sell them. A lot of areas have noticed an increase in heroin use. This is a result because RX medications, prescription medications, such as Percocet, Oxycontin, fentanyl, etc., are getting scarcer on the street. This scarcity has raised the prices of these drugs. As a result, the dealers are offering heroin as an alternative for the addicts, and it is cheaper. $10 for the heroin, which has more than one dose in it, versus $35 and up for one single oxycodone pill. And it gives a very similar high experience. For some people, heroin gives a better high. The reason for that is heroin, just like oxycodone and morphine, etc., is an opiate derivative drug. With this array of medications available to chronic pain patients, many that have the potential for abuse, it is the patient's responsibility to store their medicines in as safe a manner as possible. I'm going to go ahead and end this video now. The second video will talk about specific steps you can take to help protect you and your medications and your prescriptions at the doctor's office, at the pharmacy, and in your house. I do all of these steps with mine, because I'm not willing to lose my pain medication, which I would. So I'll see you in the next video.